Dr. Firoz. I'm one of the doctor in this TP surgery. Are you Emma Collins?
Yes, that's me.
Can I confirm your age, please?
I'm 30 years of age.
Mhm. So, what would you like me to call you?
Oh, Emma is fine, doctor.
Okay, nice to meet you, Anna. How can I help you today?
Well, you see, doctor, I've actually come in with my son. His name is Leo. He's 14 months. And
Mm-hmm.
Leo has not yet started walking on his own. And that's kind of making me a little worried. Because children of his age are walking on their own, and my son, he's kind of lagging behind.
Okay, I'm sorry. Just can you repeat his age for me?
He's 14 months.
Okay, okay. So, when did you notice that he is not working properly?
I mean, he holds on to things and he tries to walk, but he can't walk on
Mm-hmm.
his own. And I've seen my, neighbors' kids who are of his age, they are nicely walking on their own. I don't understand. Is there something wrong with him?
Okay, we'll talk about it. So before that, I just wanted to ask few more questions to understand what is going on with your son. Okay,
Okay.
so apart from this working problem, does he have any other issues? Like is he his all other development like eye contact, everything is okay?
I guess so. I mean, what exactly do you want to know?
hmm Like uh, does he able to make eye contact?
Yeah, yeah, he does. I mean, he lights up when we are, when we enter the room or when he sees us.
Mhm. Okay, and does he able to talk, speak few words?
Yeah, at this point he can say one or two words,
Okay,
like Mama
and
Darling.
okay, that's good. And so about his walking problem, like does he have any limping of his limb? Like does he limp?
I mean, not that I've noticed, but he
Mm-hmm.
does. He does hold on to things and he walks, but he
Okay,
can't
and
even walk without holding on. I mean, it's been he's 14 months. I mean, it's more than a year. I mean, that's when kids start
okay,
walking, right?
yes, okay, and does he have any joint problem? Like
Not that I've noticed.
okay, okay, so. How was is he your first child or do you have any other children?
Well, he is Leo is my first. Yeah, you're right.
Does he have any fever?
No, doctor, he doesn't.
Mhm. Okay. And is he able to eat and drinks?
Yeah, he's fine. He eats, he drinks, he poops, he pees. All that's fine.
Okay. Okay. And is there any swelling or redness in any of the joints of the leg?
No, doctor, not that I've noticed.
Okay. And I'd like to ask few more question about your pregnancy. So how was the pregnancy?
Yeah, pregnancy was all fine. It went all well.
And what about his birth? About your child's birth? Like birth, was he okay after birth?
Yeah, he was absolutely fine. It was normal birth.
And is he up to date his immunization?
Yes, he's completely, up to date with all his immunization jabs.
Okay. And okay. Um, and what about his other? Okay. So okay. And thank you for. Does he have any medical condition?
No, doctor, he doesn't.
Okay. Okay. And any medication? Is he taking?
No, no, he's not taking any medication.
Okay. So thank you for answering my question. Okay. So okay. So where is the child now?
Well, I didn't bring him in. I thought
Mm-hmm.
I'll come talk to you first.
Okay, so it's better next time you need to bring your child so we can check him physically so we can give you the more information. But from what you have said,
Mm-hmm.
it does. I'll tell you that we can assure that he is little bit delayed, but that doesn't mean that he can't work. Usually, in case of the child, any of the child, until 18 months of their age, they will learn how to work. So he has still 4 months ahead. Are you
Okay.
getting my point?
Oh, I see. Okay. All right. I wasn't aware of that. All right. So
Yeah,
it's
so
absolutely fine if he doesn't manage to walk on his own yet.
no, as you mentioned that he is trying to work, so but without
2 minutes
support he
remaining.
cannot work. So I think he have still 4 months ahead. So by this time, he will try to be more independent. But
Mm-hmm.
I think you can help him to be work alone. What you can do, you can give him support. Like you can emphasize him that to take few small steps to go ahead. You can encourage him.
Okay, I see.
Do you understand?
Yeah, yeah, I
Okay.
understand. We've been trying that actually, and I was a little
Mm-hmm.
worried because I thought he was growing up so fast and not learning how to walk, so that got me a little worried. I thought I should
Yeah,
talk
I
to a doctor
understand.
about it. Hmm.
Yeah, I understand that as a mom, it's totally understandable that
Yeah.
if your child is not yeah, it's totally understandable. But what we can do in these 4 months, we can check. After that, you can bring him, or we'll check him again. So if
Okay.
there is any kind of delay, that time we can send him to the for this developmental assessment.
Okay, I see. Yeah, I'll do that. Do you need to do any investigations to see,
Yeah,
what
so
could be wrong?
yeah, in 4 months when you will come, bring him your child. That time we can do some X-ray to
Mm-hmm.
check if there is any other any issues with him or not. So we can do
Mm-hmm.
that. Some basics in test we can do.
I see. Yeah, that would be very helpful.
Do
Yeah.
you have any other concern?
No, just that I was actually worried on why, Leo would be lagging behind.
Yeah, it's so
Move on
we'll
to the next station.
Thank you so much. That was good. That was good. That's good. So when it comes to these developmental thing, mainly they ask you two things. One is the verbal, development,
yeah.
and the other one is walking. So it's 14 and 15. So this is 14 and the other one is 15. So couple of important things you were very right about doing was you understood that every other skills milestones are you know at par. You checked for social, you checked for talking, and you could have checked for fine motor like pincer grasp,
Yeah.
busy holding on to things, and a couple of things like that. But yeah, it was all fine. So this is the time when 14 months they actually start recognizing, so they understand, they smile at when you call their name and all that, right? So that is all at par. You understood that immunization and everything was up to date. So let's just look at the examiner's checklist.
Oh, all this is because I didn't do it. Yeah.
No, not at all. So a couple of things you need to ask, and the other important thing is there any family history of developmental delay? That is something you have
Okay.
to understand, right? Because if this is there in the family, if they have any genetic problems that could be predisposing, and so that is important. And if the child birthing everything was right because cerebral palsy. The other one is, so it's
Okay.
Grover sign. Over there you have a do you know what the Grover sign is?
I read it before, but I forgot now.
Okay, so that is when you get up with the help of your hands. Every time you have to get up, you need to hold
Hmm.
your hands. Your calf muscles are kind of,
Hmm. Yeah,
displacing.
using the support before
Exactly, they
standing.
have to
Yeah.
hold, use their hands for support. So, so you can ask them, how is there a special way that he gets up? Couple of questions, because the parents will
Hmm.
be very much aware of their child's condition. They will look at everything that they're doing. Right,
Okay.
so any small little things like this, like is he sleeping well, is he eating well, how is there a special way that he gets up or something like that, they'll be very attentive towards, especially for new mothers. That's why that's one of the challenging challenges of parenting, because they see that everybody else is doing and your child is not doing. They kind of get FOMO. Right, so they feel like their child is lagging behind, but your job is to tell them that this is actually normal. And you were absolutely right. You went and said that until 18 months, do not they might not actually get that. So you can actually wait for 18 months. How about I set up a follow up for the next 2 months? We can see how he's doing. If there are any more tips I can give you, if there are any more changes, anything that I can help you with, right? So usually try to keep the follow up like 2 months, because you said 4 months he still has time, right? We wouldn't consider it any matter of concern until 18 months, but let's arrange a follow up and let's see how the progress is in the next 2 months. That gives them a little more confidence that you're not waiting till the end of the time that you've mentioned, but you're also giving me a follow up before that to see how well I've my child has progressed. So that gives you reassurance, right? So it's like saying that my exam is on 5th, so let's meet on 4th so that I know how much you've done. Rather than that, how about I meet
Yeah.
you on
Okay.
2nd and see how much you've done, and I'll give you more tips so that you can prepare till 4th.
Yeah.
Like in that sort of a manner, right? So, vaccination history, yeah, that way you ruled out polio. Yeah, you asked about infection, if this will actually be, yes, anything, any pain, in any pain that he's experiencing, does he cry when you touch his
Hmm.
joints? Is there any redness, swelling? You mentioned that, right? And P. Maftosa, yep, pregnancy, birthing, socials, right? Socials you need to understand a little bit more because it's a child, right? So there are a couple of things that you need to keep in mind when it comes to a child, like who is taking care of the child, right?
Okay.
You need to understand, because pediatric cases are a little challenging. There are certain questions that you have to ask, like who is taking care of, since it's a child, like who is the
Yeah,
person
because
who observes
we
the
need to
child.
find this non-accidental injury like this. We need to rule out this case or
In
not.
this case, you're not actually looking for a non-accidental injury because the child doesn't have
Hmm.
any injury as such. This is a
Hmm.
over-concerned mother. So
Okay.
the non-accidental injuries when they come with a injury, right? That's when you're actually
Okay.
worried that how did this injury happen? Because this child doesn't really have any problems. This is a mother who thinks this child has a problem, but you're trying to console her that your understanding of your child having problems is not adequate. Let me give you a little more idea, right? Over here you're trying to understand about the social history, because you need to understand who all takes care of the child. What if the child had a moment where he walked on his own but nobody noticed him?
Hmm.
Right, so you need to
Okay.
understand who all notice him, right? Who all would know about his condition, or who all are around him, who to observe, because children can't talk, children can't communicate.
Hmm.
Their only means of communication is by emotions, and the only person that they can develop that emotion is the person who is with them at all times. So you can only talk to that person technically, right? Because that person will be able to tell you the right emotion. So you need to make sure that the mother is the person who is with the child at all times. So who all take care of the child? If you're not at home, who takes care of the child mainly, right? So that is the best person to talk to about the child's condition. So that yeah, red flags, there are a couple of red flags. So since this is the thing that she's concerned about, when it comes to pediatric cases, you have to mention red flags. Other red flags, like if you notice that he has high fever, if he has any problems in breathing, make sure you take him to the hospital. Even though she's come for another concern, there are certain red flags that you have to tell them, that if he has any signs of dehydration, if he feels out of breath, or if he has high fever, make sure you come to the hospital immediately. Because children are very delicate, right? So you want to
Yeah.
always keep informing and reinforcing to the parents that these are things you have to look out. Even though you're looking out for signs, I understand you're doing a great job, good job that you're doing this, but there are a couple of other signs that I would also want you to look out for. Just in case, if you see it, please come to the hospital, right? You're just trying to keep them informed, because they are also new at this.
Yeah.
They are also trying to understand what all do I need to be concerned about and not. So you're trying to give them a direction that this is concerning and this is not concerning, so keep that in mind. Yeah.
Okay.
Signs of severe illness: if the child has persistent fever, difficulty breathing, having weight loss unexpectedly, these are the things you have to be worried
Yeah.
about. Like, because they are new at their job, so you have to tell them that, okay, good job, you have super attentive focus towards this, but make sure you have your attention towards this as well. I just want to tell you that, just to reinforce
Hmm.
that, right? But otherwise, that the station went well. Good job. All
Okay.
right. Mhm.
Please like and subscribe to TuringMedSchool. Good luck with your preparation.